Welcome to Channel 17, the Town of Colonie Government Channel.
Hello, and welcome to the Senior Resources Show. My name is Chris Cary, Director of the Town of Colonie Senior Resources Department. Thank you for joining me today. Today, my guest is Candy Rivera Whitehead, Outreach Representative from the New York State EPIC Program. And New York State EPIC Program is the Senior Prescription Plan, which many seniors I know are familiar with. Candy, thank you for joining me today.
Thank you, Chris. It's a pleasure to be here.
Well, thanks. I know much about EPIC, you know much about EPIC, and a lot of seniors know about the EPIC program, but my concern always is that there's a lot of seniors that need prescription drug coverage that are not aware, even though EPIC is well publicized in senior centers and pharmacies and in different places around the community, aren't aware of the EPIC program. So if you could start by telling me a little bit and telling our viewers a little bit about the EPIC program.
Yes, definitely. You know, as you indicated, EPIC has been around for quite a while. We're actually in our 21st year. And the New York State EPIC program actually was created because Medicare never covered drugs, outpatient drugs, before January of 2006. For over 20 years now, the state of New York has had the New York State EPIC program. And we have currently about 320,000 seniors enrolled in the program that save on an average of 80% or more on the cost of their prescriptions. Anybody that you've ever talked to that is currently enrolled in EPIC, those seniors are very, very happy with the EPIC program. And actually, I can't tell you how many times I'm approached as I'm out there in the senior centers, and seniors will come up to me and say, I don't know what I would do without my EPIC, because it's such a good program.
Oh, I hear it all the time, and I know I speak for myself and my colleagues. If it weren't for the EPIC program, even today and even before 2006 when the Medicare D went into effect, I don't know what we would have done. I don't know what the seniors would have done to fill their prescription drug needs. Can you talk a little bit about the eligibility, how old you have to be? And I know that there's two different plans under the EPIC, so if we could kind of go through the two plans.
Sure. Okay. Well, first of all, in order to be eligible, you have to be eligible for the EPIC program, and the eligibilities are if you have to be 65 years old or older to be in the EPIC program. Unfortunately, it's not just if you're on Medicare or if you're under 65. You have to be 65 in order to be eligible for the EPIC program. You also have to be a resident in New York State, because after all, it is a New York State senior prescription plan, and there are income eligibilities. For example, for a single person, and by single I mean that can be single, widowed, or married living separately, we look at them as a single person, their income has to be under $35,000 of the year. If they're married living together, they must combine their income, and the combined income would be under $50,000 a year in order to be eligible for the EPIC program. And I want to stress that it is income. The New York State EPIC program does not look at assets, so doesn't matter if you own your home or anything like that. We're not looking at assets. It's strictly income. And it is income for the previous income year of the year that the person is applying in. For example, if someone is looking into enrolling into EPIC this year, 2008, we're going to look back based on their 2007 income. So again, the eligibilities would be 65 years old or older, a resident of New York State, $35,000 or less for single, and married combined under $50,000.
And if a senior is looking ahead to next year, and they're going to be 65 in November, and it's the beginning of the year, and they're starting to think about plans, do they have to wait till their 65th birthday, or is it their 65th year that they can enroll into the program?
That's a good question. Actually, they have to wait till they're 65,
okay.
Because they can actually enroll up to 30 days prior to their 65th birthday.
Okay.
In other words, they can start looking into it, actually filling out the application and mailing that application into the EPIC office and 30 days prior to their 65th birthday. If we process it and it gets approved prior to, like let's say 2 weeks after they've sent it in, the effective date will actually be their their birth date, 65th, when they're 65. The effective date will be on their birth date, because you have to be 65 in order to be eligible for EPIC.
And does the program cover the snowbirds who head to Florida or down south for 4 or 6 months of the year? Can they still have EPIC coverage if they're winter travelers?
Yes, they can, and the reason for that, and I want to specify it, like I said, they have to be a resident of New York State. But we have many seniors that are enrolled in the EPIC program that actually, as you said, go to either Florida or another warm state for the winter months. The key that is that their residency state is actually still New York State. They're filing their taxes. They're still considered a resident of New York State. Now, they can go to, for example, Florida and be in Florida. The key is that they're not going to be able to walk into a pharmacy in Florida, show their EPIC card, and receive the EPIC benefits. What they would have to do in that case is that they could call their New York State pharmacy and have the prescription mailed to them either by the pharmacist, or a friend or a relative could pick it up. But the key to that is that it has to be purchased in a New York State pharmacy in order for it to be covered under the EPIC program.
Okay. Well, for people who are planning a trip, can they purchase a 90-day supply before they go under the EPIC program?
Well, yes. Under the EPIC, primarily at this point, is if you can have a 30-day supply or 100 tablets, whichever is greater. So we do have that benefit for our seniors enrolled in the program. But keep in mind, and we can talk about that a little bit later when we get into the Medicare Part D, that may be affected. But for the most part, if they're enrolled in EPIC and they're eligible to get a 90-day supply, they would most certainly be able to get it.
Okay. Can you talk about the two different plans under EPIC? As far as how the fees work for the plan, or if they're on the deductible plan?
Yes, well, as I told you, there is our income eligibilities to be eligible for the EPIC program. Now, once they're eligible based on their income, it actually depends on their total income for the previous year. That's going to determine whether they're going to be eligible for one plan or the other. As you indicated, we do have two plans within the EPIC program itself, the first plan being the fee plan. And the fee plan is eligible for single seniors whose income is under $20,000 a year, or married living together under $26,000 a year. If their income actually falls below those levels, they're going to be in the fee plan. The fee that they actually pay is determined based on their income. So, everyone who's in the fee plan is not going to be paying the same amount. It is going to be determined truly based on their income. The fees are quarterly fees. So if you're looking at an EPIC brochure and you see the fee schedule and you look, those are annual amounts listed there. We bill quarterly. Now, once a person who's eligible for the fee plan actually enrolls into the fee plan, they get their EPIC ID card, they pay their quarterly bill, what the fee plan does is that enables the senior to go to a participating pharmacy, which probably 95 to 98% of all the pharmacies in New York State participate in the EPIC program. They're going to be able to go to a participating New York State pharmacy, present their EPIC ID card, and from that point forward, they pay co-payments on their prescriptions, anywhere from $3, $7, $15, or $20. A senior who is in the EPIC program paying co-payments will never, ever pay a higher co-payment than $20 for any prescription over 55.
That's
So
quite a savings.
it is quite a savings. And obviously, the more expensive the drug is, the more the savings to the senior. Because once it's over 55, whether it's a $70 prescription that they pay $20 or a $700 prescription, they're going to pay $20.
That's remarkable savings.
Yeah, so pretty much that's the fee plan. Now, if their income as a single senior is over the $20,000 level or married over the $26,000 level, then what happens is that they're eligible for the next plan, which is called the deductible plan. The deductible plan is actually free to the senior because they don't actually have to pay a fee to enroll in EPIC. They will have a deductible that they will have to meet that is, again, based on their income and their marital status. They will receive an Epic ID card, again, present it to the pharmacy, participating pharmacy, and they will pay the full price on the cost of their prescriptions up until they've met their specific deductible amount. Once they have met their deductible amount, then how they start saving with Epic is that at that point, they start paying the co-payments of $3, $7, $15, or $20. So the difference is with the fee plan, the lower income people, they pay a fee and get their discount throughout the whole year by paying the co-payments of $3, $7, or $15. The deductible people start benefiting only after they've met their deductible.
And I remember one time you talking to me about a person who didn't join Epic because they didn't have any drug plans, and didn't have any drug costs, excuse me, and they would have been in the deductible, and you said to me, why not? Why not join? It's not going to cost you anything, correct?
Exactly. I mean, it's just unbelievable when you realize that you're in the higher income level, you're eligible for Epic, and why not get it? Because, it's not costing me anything. So it's a safety net. Mm-hmm. And you and I both know that we can be sitting here today and we don't know what's going to happen tomorrow. We could be not taking any medications today. Tomorrow, an unforeseen situation occurs, you go into the hospital, and you come out with 5 prescriptions that you never had before. At least at that point, you're already on Epic. Granted, you're in the deductible, you're going to have to pay up front, as you meet your deductible, but from that point forward, you start saving on an average of 80%, and it didn't cost you anything to have it.
And as I didn't know that, I know many seniors aren't aware of that, or family members that are helping their parents or loved ones look at prescription drug, options that are available. You don't always think about those things, and like you said, you're well today, but things unfortunately can change very quickly, and I see it every day in my work, how someone unfortunately can be healthy one day and have a turn of events the next day. So I think that's very important information. I oftentimes find that situations come up in seniors' lives, the death of a spouse or the loss of employment or loss of some kind of income. If they've been ineligible for Epic and say they're ineligible for Epic now, but because of their income the year before, their income has suddenly changed. Do you look at that during the year? If someone was going to reapply, last year their income may have been over the guidelines, but this year there's been a significant change in their income. Do you look at cases individually ever to see if a person, due to their current income situation, may be eligible, or is it always based on the previous year?
Okay, so I'm assuming that you're talking about a person coming into the program for the initial period of time. Okay, there was 2 things there that you indicated, and one situation was which happens every single day. You have a person that they're looking at, we're currently in 2008. Let's say they just retired. Here it is, June 2008, and they retired. The law indicates under the Epic program that we have to look back at previous income year. Mm-hmm. Well, the reality is that previously in 2007, income-wise, because they were working, they may not be eligible for the Epic program. That particular person would have to wait till January 2009 and look back at their 2008 to see if it made them eligible based on the fact that they may be retired in the middle of the year. So in a situation like that, it's strictly previous year's income, and they have to wait till the following year. Now, you also mentioned if you have a situation where let's say here we are again in June 2008, and we have a senior who's a recent widow. Okay, she's looking at Epic. Maybe she lost her prescription benefits because she had it through her husband's plan. She can enroll in Epic. She's coming in 2008 as a single widowed person. And she has to go back and look at 2007. Well, in 2007, she had her husband's income as well as her own. In that scenario, that widow applying as a single person in 2008 will look back to 2007 and only have to claim the income that came in her name, meaning her Social Security, Any joint accounts that she might have she would have to file 50% of the joint accounts. So in that situation, it actually is going to benefit her. We look back still always at the previous income year, but because she's a recent widow, we're only going to pick up income that came in her name only and half of any joint account. So she would actually benefit better that first year.
There's two different kind of sets
Yes,
of rules depending on what your situation is. You know, I've called your 800 number many times, and I've always found the EPIC program to be the most user-friendly of all the programs that seniors can apply for. And I urge seniors many times, if they have questions that I don't have maybe the information on, to pick up the phone, and the customer service representatives just talk seniors right through their particular situation. And I think that's a terrific asset of the program, and I'm sure you hear it all the time from seniors, how easy it is to pick up the phone and call the 800 number.
It is. You know, our 1-800 number and our helpline representatives have a very good reputation. And I think the most important thing is that when you do call our 1-800 number, you're actually going to speak to that real life person. There are no phone trees. You're not going to have to press 1 for this or press 2 for that. You actually speak to a real life person. And that's important because each person, each senior that calls the helpline is an individual with different situations, different questions. Therefore, they're going to be able to talk to someone that's going to listen to what it is that they're asking, what their situation is, and hopefully give them an answer that's going to be specific to them. And it's very important that, you know, we have many times where seniors call up and say, well, my neighbor is, you know, only pays this amount, or my neighbor said that she only has to do that. Well, that may be true for her or him. But your situation specifically, this is how it applies to you. And that's why it's so important. If there's ever a question about EPIC, it's very important. Pick up that telephone and call our 1-800 number, which is 1-800-332-3742.
Yes, I find it to be a very unique service that, like you said, each person is an individual and you
Right.
don't go to a phone tree, and it's
Right.
it's a terrific benefit. Well, we're going to get to the part that I find with many seniors to be the most challenging. As you mentioned earlier in your remarks, in 2006, the federal government rolled out the Medicare D program, and this is where everything became complicated for seniors. I know as a provider of senior services, the learning curve was tremendous for myself and for our staff, and we're constantly working to stay updated on the changes that are occurring. And it seems every year we're faced with new challenges as seniors try to pick what's the best plan for them, how does it interface with EPIC. I was hoping that maybe you could talk a little bit about how the EPIC program and the Medicare D programs work together.
Sure. First of all, I'd like to make sure that you know, seniors are understanding that, again, I emphasize the fact, EPIC is a state prescription plan. We've been in existence for 21 years, even before Medicare covered prescriptions. So now the federal government is offering a prescription drug plan that people refer to as called Medicare Part D. As of last year, in 2007, July of 2007, it was passed as law, basically, that now people who have EPIC, the state plan, are now required to have Medicare Part D, where in the first year when Medicare was rolled out, we went out there saying, oh, if you have EPIC, it's okay, you can stay, you don't have to sign up for Medicare Part D, EPIC is credible coverage, okay to stay. Seniors were thrilled about that because
Yes, they
they
were.
love their EPIC. Last year, it did change the law that said as of July 2007, you're now required to have a Medicare Part D. And, you know, some people were, you know, upset about that, but the reality is that it is a wonderful situation where you have a state plan and a federal plan actually paying those prescription drugs before you actually pay. And how does that work? Because once you're enrolled in a Medicare Part D, which, by the way, if they are enrolled in EPIC, and when that law took effect, we actually did it all for them. We picked out the plan for them that best suited their needs based on the prescription drugs that we already knew that they were on. We selected the plan for them. We enrolled them into that plan. And if they're in the fee plan within the EPIC program, we actually paid the premium of their Part D. So you have a senior who's in our fee plan, okay, who is now being told, oh, you have to have Part D. Well, not only are they going to have two coverages, but the fee is being paid by the state. We're going to pay that premium, so it's not costing them anymore. And they have EPIC that they're paying. They've always paid that fee. Everything that comes out of their pocket under Part D will also go towards their EPIC, so they're going to be paying lower co-payments, okay? If they're in the deductible plan with EPIC, right, EPIC is a secondary plan to their Part D, everything that comes out of their pocket will also go towards their EPIC deductible. So the reality is that they have a Part D, they have EPIC, they have federal and state, again, emphasizing the fact that they're saving more by using the two plans before they pay.
Well, I know that once we were really able to do some education and some outreach around the way the two plans could work together, seniors were almost in disbelief at how low their drug costs became, because the two plans really did work together to lower the co-payments for the senior. So it really has worked to most seniors' advantage, I would think, to be in the two plans.
Oh, it does. It's funny because I was I was at another location earlier today, and I was talking to a senior who currently had Medicare Part D, and actually had been telling me, oh, I've been thinking about signing up for EPIC for a while now. My kids have told me about it, but I have that brochure at home, but I never actually, looked into it. Well, this was the opportunity. I explained the program to this person, and he told me one of the things. I says, well, give me an example of a co-payment that you would pay under Medicare Part D. And he says, well, one of my co-payments is $30. Well, it just so happens that when I looked at his information and found that he would be in the fee plan within the EPIC program, which means he pays co-payments right away, I said, by you signing up for EPIC, you would now, that $30 co-payment under Part D would now go to EPIC, and you'd end up only paying $7. So, and that was only one of his prescriptions.
And EPIC was going to pay his Medicare Part D premium on top of that.
Exactly. Correct? And I'm telling you, he was ecstatic about it.
day.
Yeah, exactly. He could not, I'm saying, now you see, don't you regret now waiting so long? Mm-hmm. And that's the thing. And that's why programs like these are so very important, because it's a matter of education. It's a matter of making sure that you understand, what are my options out there? And, is there something else that I may be eligible for that can actually save me more money than I'm already saving right now? Mm-hmm. Or I'm not saving enough more, it's enough money, it's still costing me a lot. Look at that state plan.
And I think in these economic times, it's even more important. I worry all the time about the upcoming winter months and how seniors are going to handle the heating costs and their food costs and gas costs. And if there's an opportunity to save a little more on your prescription drugs, it's certainly worth looking into. I'm interested because the way your program is able to really research the Medicare Part D plans and find the best plan for a senior, because you have all their formulary information. You know all the drugs that they're on. When I counsel an individual on a Medicare Part D plan, I go into Medicare's website and plug in all their drugs, and it takes time, and you have the ability to know very intimately what drugs they are on, so you can find really the best plan for them. You know their usage and so forth.
Well, let me clarify that a little bit, because in that situation, when last year in 2007, when it became law that people who have EPIC are now actually have to have a Medicare Part D, these people were already in EPIC. So we already had a claim history on them.
True.
So we were
That's
able,
good clarification.
we were able to look back at their claim history. The situation that we might have right now is that we have a new person coming into EPIC, first time EPIC participant. and they enroll in Epic and they happen to be in the deductible plan. Well, we're not going to have a claim history on them. So actually, our assignment of a Part D, if it is a requirement for them, because there are some exceptions, is that it's going to be a random selection. What I would encourage someone, and that I'm glad you brought that up, because that would be, it's important that they understand that we are going to, at that point, randomly select a plan for them.
And that's what we do too.
Right.
Really.
They're going to get a letter from Epic saying, this is the plan that we selected for you, okay? And I'll be honest with you, it may not be the best plan for them. What I would encourage them to do at that point is maybe contact, Colonie Senior Services and maybe come with a list of their prescription drugs, or, contact Epic. Somehow, talk to someone that's able to evaluate the claims at that point. Because from the time that we say, here's the plan that we picked for you, they have 30 days to choose a different plan that's going to work better for them. And the key is we want them to be in a plan that's going to work for them, to get the best benefit of the two plans. So that's really, really important.
Yes, it is. And it's important for me to also mention that in the town of Colonie, our Senior Resources Department, all of our caseworkers are trained HICAP health insurance counselors, New York State health insurance counselors. So we can sit down with folks individually, even if you don't think that you're eligible for EPIC or you're way over the income guidelines. We have the capacity to sit down and bring in a list of your drugs, make an appointment, and we'll sit and go through and look at what might be the best option for you. Another important piece of information that I want to share is that each month we have a benefit assistance day on the second Friday of each month at the Beltrone Living Center. And I know you're always available on that date by appointment in the afternoon to meet with people individually. So I appreciate that you make yourself available for that program. Also available on those days so that seniors can have a one-stop shopping for benefits. They can apply for food stamps, Medicare, Medicare D. And one thing we didn't touch on too much was the low-income subsidy that's available for seniors to help them, for seniors who are income eligible, to help pay for their Medicare Part D drug costs. Do you want to touch on that just very briefly, because I know that it can become complicated?
Yes, that part is fairly complicated for a lot of the seniors. But what I want seniors to realize is that if they're already in EPIC, the low-income subsidy, what that references is the fact that if their income and assets are under a certain amount, then that means that the federal government may provide the Medicare Part D free, okay? So you think about it, we have a state plan, we have seniors that are enrolled in our state plan. We know what their income is because they have to provide us with the income information. Because we have that information, we will, when a new application comes in, we evaluate it, and if they seem to appear to be eligible for the low-income subsidy under Medicare Part D, under the federal government, if based on their income it appears that they're eligible for Medicare Part D free of charge, guess what? We will process their EPIC application, but at the same time send them a notification that says, hey, look, based on your income, you appear to be eligible for this low-income subsidy. Fill out this application, send it back to us, or we're going to apply for you. Now, the benefit of this is not only do they get their Medicare Part D premium paid for by the federal government, we will also waive their EPIC premium. So in essence, they have Part D free, they have their state plan EPIC free because we're waiving the premium, and their co-payments are much lower. They'll only pay $2, and I believe this year it's $2 and some change for generic, and $5.35, I believe, is for name brand. Yeah. But the point is, the highest the co-payment that they're going to pay is $5, because under the federal and under EPIC, they're going to have a different benefit, because they qualify for the low-income subsidy. So this is a lot for them to remember.
It is a lot.
All I want them to understand right now is when they apply for EPIC, we're going to do that for them. We're going to let them know. If they qualify for it, we're going to provide them the paperwork that they need. We're going to apply for them. And again, they have, Colonie Senior Resources, which
Right.
you're fully aware of that too, that they can access and find out whether or not they're eligible for it.
Yeah, always we're available to meet with people on an individual basis to look at their current situation in a confidential manner. Would you recommend that people call the 800 number if they have questions, or should they wait and make an appointment to see you when you're at the Beltrone Center each month for the Benefit Assistance Day, or what would be your recommendation?
I would probably say that rather than wait, if they're not in EPIC right now and they think that they might be eligible for it, then they should probably just call the 1-800 number and obtain an application. We will mail them a brochure, or frankly, they can go to any local pharmacy, say, do you have an EPIC brochure with the application in it, and fill out, because the sooner that they apply for it, the better.
Right.
So, but like I said, I will be at the Colonie Senior Services, on the second Friday of each month. So if they want to sit down and talk to someone, they're more than happy to wait till then until they can talk to an EPIC representative. But my point is, if you think you're eligible, get in, and get in as soon as you can, because the sooner you're in, the sooner you're going to start saving some money.
And in closing, I want to tell our viewers that you'll be available September 12th to do a lunch and learn program for us from 12:45 to 1:15. And I imagine there'll be some changes with EPIC, like there is with all the programs with each new calendar year. So hopefully you'll be able to share with us some of the new changes that may be occurring, and go into a little bit more detail about how the program works. So I hope to see you then. I know I'll see you then,
Yes.
actually. So, and I hope that our viewers will call my office at 459-5051 for more information on the Lunch and Learn series, as well as how to set up an appointment to meet with you directly.
That would be great. It actually comes at a great time because, October, November, and December, that's the beginning of the open enrollment, so that people can evaluate where they stand now with their current medical or prescription drug plan for the next year. So this Lunch and Learn comes at a good time to start looking at what my options are.
Yeah, that's why we booked you
Yeah.
when we did. So
Yeah.
thank you very much for joining me today, Candy.
you,
This
Chris.
has been great information. Thank you for joining me today on Senior Resources with Chris Cary. I hope to see you next time. Have a good day.
Welcome to Channel 17, the Town of Colonie Government Channel.